My name is Luke Rothermel, and I'm the senior author on the publication Predictors of Sentinel Lymph Node Metastasis in Very Thin Invasive Melanomas. My research team comes out of the University Hospitals, Cleveland Medical Center, Department of Surgery in Cleveland, Ohio. This study was done to provide more detailed information about the risks of sentinel lymph node spread in patients with very thin melanomas, less than 0.8 millimeters in Breslow depth. Per national guidelines, these patients are not recommended for sentinel lymph node biopsy because the rates of nodal spread are less than 5% and the risks of the procedure are not justified. However, until recently, data regarding this specific group of patients were extrapolated from studies looking at all thin melanomas 1 millimeter in Breslow depth or less. We hypothesized that high-risk features could be identified in these patients that could help predict higher rates of nodal spread. And to do this study, we queried the National Cancer Database in the United States for adult patients with very thin melanomas who underwent sentinel lymph node biopsy. We included patients with a Breslow thickness less than 0.8 millimeters who were clinically node negative and had no evidence of metastatic disease. And we excluded patients if their biopsy had a transected deep margin. We examined characteristics such as those of the patient, their tumor, and their treating hospital facility. Positive nodal spread was seen in 5% of patients overall, and tumor characteristics such as lymphovascular invasion, ulceration, mitosis, and nodular subtype were associated with higher rates of nodal positivity in multivariable analyses. When 2 or more of these features were found in a tumor, those rates increased significantly. However, these high-risk features are uncommon in very thin melanomas. But importantly, 5-year overall survival was worse for patients with nodal spread or with high-risk tumor features. So this study can guide physicians in the shared decision-making process when patients with very thin melanomas are considering sentinel lymph node biopsy, and it can help to better select patients for whom this procedure may be beneficial.